All right, everyone. Again, thank you so much for taking time out of your afternoon to join the ACM team for this webinar covering Medicare this afternoon. I'd like to take a brief moment and introduce our speakers for today's call. Today, you will be hearing from me, Livia Thomas, as well as Jake Taylor and James Smith. We are all part of the advisory team here at Aspen Capital Management. Before we get started, I want to go through a couple of tech items and logistics so you know how to navigate your screen and how to do questions. One of the best ways to experience our webinars is to make sure your screen is in full view. So many of you have joined our calls in the past. You will hear or you will see up there in the upper right-hand corner where you can adjust your view on the screen. You will also see a place where you can submit questions. So if you look down below at your toolbar, you will see the dialog bubble and the word chat. You can just click on that and make sure that you send questions to your first option, which will be webinar questions. You're welcome as we go through the webinar to put your questions in there, and we will address those throughout the call as well as toward the end of our presentation. So I want to give you a brief overview of what we're going to cover today. Keep in mind, Medicare is a very large topic, and the details go well beyond the 20 minutes we have together today. However, we want to make sure we point you in the right direction as you begin your journey within Medicare. So our goal is to provide you with some education about key events and dates for signing up. We're going to walk through a couple of common strategies and direct you to any additional resources as necessary. As I mentioned, this is a rather large topic, so we want to make sure that you have access to all the best experts as you navigate this individually and in very great detail. So I will be covering the enrollment periods and eligibility. Jake Taylor is going to spend some time talking about the benefits and common strategies. And James Smith is going to walk through expert advice on Medicare and get you pointed in the direction of those resources that you can use on your individual time. So let's get started with enrollment periods and eligibility, which is essentially answering where and when do I start this process? So a couple of things you need to be aware of. Upon initial enrollment, that starts 3 months before your 65th birthday. And so at that point in time is a great period to sign up for Part A and B to make sure you avoid any coverage gaps or penalties. Now, you may have heard of automatic enrollment. That is something that takes place if you've filed for retirement or disability benefits from Social Security. You should keep in mind that if you are getting those benefits at least 4 months before turning 65, you will automatically be enrolled in Part A. You will be signed up for Part B, but that is something that you can opt out of. But just keep in mind that if you aren't already getting Social Security benefits, or if you haven't already signed up for those, you do need to actively sign up for Part A and B. You won't just automatically be enrolled. A couple of other key dates to keep in mind for open enrollment. So this is something that comes up every year on the same date. So you've got October 15th is when open enrollment begins, and that goes through December 7th. Keep in mind, this is the period of time that you can modify and change coverage if you're already enrolled in Medicare. And your first date of coverage begins January 1st of the following year. So December 7th will mark the end of enrollment for 2022, and then your coverage date will start January 1st of 2023. A couple of things to be aware of in terms of qualifying events. If you retire after the age of 65, or when you potentially may lose job-based healthcare insurance, that would be an example of a qualifying event that would make you eligible for special enrollment. So that's kind of outside that open enrollment. The key here is you will still have access to the same benefits with no penalty as long as you enroll during the special enrollment period. So again, that's for qualifying events that happen after age 65 and after you're done working. So if you retire after age 65. So what I'd like to do is hand it over to Jake to help you take a closer look at the different parts of Medicare and how to think about supplemental coverage.
Thanks, Olivia. Everyone, take a breath, focus in, let's get ready to go. Benefits and coverage gets complex. As Olivia mentioned, Medicare is a big topic. What we're going to do is we're going to start this out at a high level and we'll work our way down into the details so that you can start to get an idea of what's important to you in your specific situation, and then work towards making the decision that's right for you personally and your family. All right, we're going to start with the different parts of Medicare. So as you look at this slide, you'll quickly notice that we have the basic coverage here on the left-hand side and the additional coverage on the right side. We're going to start on the left side with basic coverage. So with Medicare, there are 3 basic coverage options. This is going to include Medicare Part A, Part B, and Part D. Part A is going to be your hospital insurance coverage, and this is going to cover the different events such as inpatient hospital care, skilled nursing care, and other critical care that you would require while in the hospital. Part B is going to be your medical insurance. This is going to cover events such as outpatient care, preventative services, and help you cover the costs of medical equipment like a new wheelchair or other durable medical equipment. And lastly, our last basic coverage option is Part D. This is prescription drug coverage. And as many of you know or will likely know someday, prescription drug coverage gets very expensive, especially for seniors later in life. And so this is to help mitigate those out-of-pocket costs. Olivia is going to get to the costs of Medicare here later on in the discussion, but we wanted to point out a few high-level points on the basic coverage. So still focusing here on the left-hand side of the screen for parts A, B, and D. So all Medicare parts A, B, and D are going to have clearly defined costs set by the federal government. So those premiums are going to be well-known and easily identifiable for each of you. For most individuals, Part A is free. Part B, your medical insurance, is likely going to be your most expensive Medicare premium. And then Part D will be a small premium increase added on to Part B. And the reason I say Part B is going to be the most expensive for most individuals is that it's tied to your level of income. So the higher your income, the higher your premiums. Now, this is where we start to get to the details. This is the additional coverage section of Medicare. So this is going to contain two terms that likely everyone on here has heard, even if you're not totally familiar with, you've likely heard about, and that's Medicare Advantage, also known as Medicare Part C, and Medigap, also known as supplemental insurance. So why they didn't just give these one name, I'm not entirely sure, but when you hear those terms, know that they're synonymous: Part C and Advantage, Medigap, and supplemental insurance. As we start to break these down, what's important for you to know is that Medicare Part D, so one of the basic coverage options, Medicare Part C or Medicare Advantage, and Medigap are not required for Medicare. So these are going to be elective additional insurance options that you can select. Also along those lines, Advantage and Medigap, you can only choose one of them. So you have to go with one or the other. You can't have both. So keep those two important pieces of in mind as we kind of continue through the discussion and break this down, because the natural question from there is, if I can only have one, which one am I going with and which one's going to be better for me? So let's start by talking about the similarities between Advantage and Medigap. The similarities between these two additional coverage options is that both are private insurance offerings. So they're going to be offered through private insurers like Blue Cross or Cigna, or many others that you all are likely familiar with. And these companies contract with the federal government to offer these types of programs. And both Advantage and Medigap are designed with the same goal in mind, which is to limit your out-of-pocket costs. So that's important because Part A and Part B, so your hospital and medical insurance, that's going to have deductibles, co-pays, as well as some unlimited co-insurance requirements that, if you don't have some additional coverage to manage those out-of-pocket costs, could really run up if you had some catastrophic healthcare needs. So those are the similarities, and you'll notice those on the two boxes here on the right-hand side. There are some key differences between Advantage and Medigap as well. The first of those is that Medicare Advantage is a non-standardized coverage plan. So there are thousands of different Medicare Advantage plans out there. They're going to look different based on your state, region, and network providers. Whereas Medigap in the bottom right is going to be standardized coverage plans. So Medigap plans, there's going to be 10 of them, and they're going to look the same whether you're in New York, California, or here in Idaho. Another key difference between Advantage and Medigap is that Medicare Advantage is going to offer in-network coverage. So think of this as the employer coverage that many of you have either had or still have, where you're going to have in-network coverage and in-network providers. Medigap is going to cover any doctor who accepts Medicare. So that doesn't matter if they're in-network, out-of-network. There's really no such thing. It's, do they accept Medicare? If yes, they'll take you. Medicare Advantage, we're now on the third difference between these. So we're up to the top right box for the third difference. Medicare Advantage bundles your parts A, B, and D, and often provides vision, dental, and hearing insurance. So think of Medicare Advantage as a very broad, comprehensive, additional insurance option for you. Medigap, while it will still bring together parts A, B, and D, it's not going to provide vision, dental, or hearing. So you're going to have to go out and get that on your own. Now, you might ask, why would they have such a key difference? And the reason for that is this final bullet point. So Medicare Advantage, as I mentioned, is going to have broad coverage for A, B, D, vision, dental, and hearing, but you're going to have some higher potential out-of-pocket risks, as that broad coverage is not going to go as deep in certain critical areas. Medigap is going to have extensive coverage on a more narrow scope. So think of Medigap, if you have a significant catastrophic care need for parts A and B, or maybe you have some extensive pre-existing conditions and your medical costs are going to be high in a few areas, Medigap is often going to be the coverage option that best manages your out-of-pocket costs. We talked about the costs for parts A, B, and D. There's also additional costs, as all of you can probably imagine, to the additional coverage. So whether that's Advantage or Medigap, to get that additional coverage, you're going to have to pay a little bit for it. And so just know that in the back of your mind that these are opt-in options that are going to cost additional premiums. So we covered a lot of information here. We're now going to take a look at how do we actually break this down. And we're going to come to our Medicare decision tree to help you decide, you're going to opt for parts A and B, your hospital and medical insurance. Most people do go for part D, your prescription drug, and then most people do still choose between either one of Advantage or Medigap. So when you start to think about that, your options, how do you decide which one is right for you? We're going to look at this in terms of some different questions to determine, how is this important? So, what's important to me is that the ability to see any doctor anywhere. Do you frequently travel both in the country and out of the country? Do you require frequent medical care or have some known pre-existing or chronic conditions? And do you like to play it safe, knowing that you have extensive coverage should you end up in the hospital or require some significant medical care? If the answer is yes to a lot of these, you're likely going to lean towards considering Medigap. And that second point up there too, we can talk about a little bit, is that domestic and foreign travel. Medigap plans are going to offer a decent number of foreign travel options. So that is one for people who travel a bit. They lean towards Medigap. The other questions are obviously going to lead us towards Medicare Advantage. And we're going to then think about what questions would I consider saying yes to, should I want Medicare Advantage? So that's going to be maintaining lower premiums with broad coverage. So you're going to have lower premiums, but you're going to get access to vision, dental, and hearing. So, or do you live in an area with extensive network coverage? Maybe you don't need to be able to see any doctor because you live in an area with an extensive network. Do you like having a familiar type of plan, a plan that's similar to the employer plan that you've had for a long time? And then again, having that bundled additional insurance coverage. So if the answer to these is yes, you're likely going to consider Medicare Advantage. The big point here is that this is going to be different for every single person. No two people are going to look the same, as what conditions they have are going to be different, and what's important to them is going to be different. But hopefully this helps give you a framework to start thinking about the key components of Medicare and how to break down the coverage that you need. Livia is going to talk a little bit about costs, and then we'll answer some questions after that.
Thanks, Jake. So I just want to take a moment and be a little more specific on eligibility. So to be eligible for Medicare, just keep in mind, you need to be 65 years of age or older. You need to be a U.S. citizen or a legal U.S. resident for at least 5 years. And then you need to make sure that you or your spouse have worked for at least 10 years or 40 quarters in Medicare covered employment. So those three things need to be, all of those need to be satisfied, all three of those items to be eligible. Now, what we like to do for clients, whether you're coming up to Medicare age or looking ahead, we want to make sure that your financial plan has the right assumptions and cost estimations for the Medicare cost. So that top box on this slide that says healthcare, what we've done is we've taken a couple, Bob and Jane Test. So keep in mind, this is a fictitious client. We would never show actual client information, but the test couple here, you can see in their financial plan shows that when they're both on Medicare, that annual cost will be $9,984. And then when Bob passes and Jane is left alone, her cost will be $6,502. So it's important to understand how we're looking at this in the plan. And we thought this would be a good example to give you kind of a general idea about costs. So in this particular example, both Bob and Jane are of age to get Medicare. So you'll see that they don't have any prior premiums on their plan. That top box shows the cost for Bob broken down when they're both have Medicare and then when Jane is by herself. So you can see this particular couple, the assumption here is that they are under the $182,000 a year income threshold for Medicare, which means this particular couple is paying the lowest premiums available. If you are single, a single filer for IRS purposes, then that threshold is actually $91,000, but it's $182,000 if you're married filing jointly. So you can see how those costs break down for Bob, both Part B and D. Bob and Jane did need a Medigap policy, so you can see the $1,400 cost there. And then potentially they're out of pocket during Medicare. So Bob's total is that $5,011. And if we drop down to Jane, you can see her total is a little over $4,900. And then her total the combined total actually drops to 6,502 after Bob has passed and Jane is alone. So this just kind of gives you a general idea of what those cost assumptions would be for a couple at age of Medicare and kind of what that looks like with the Medigap policy. We're going to take a brief pause here. I know we've covered a lot of items, and as you can see, there are many considerations you should be thinking about when it comes to signing up for Medicare and deciding what modifications may be necessary in the future. So we're going to take a moment to check the chat for questions about what we've covered so far, and see if we can address any of these questions before we get to our third and final section. So one of the first questions that comes in is related to what happens to coverage when traveling outside of the US. So Jake, I know you've got some experience with this. Would you like to address that question, please?
Yeah. Well, Olivia, no personal experience for me. As everyone knows, I'm still a few years away from being on Medicare. However, with that, so Medicare Advantage plans, they're going to offer in-network coverage. So for either domestic or foreign travel, you're going to want to make sure that you have some different coverage options if you plan on doing some extended trips, or maybe you're just concerned about a medical situation while on vacation in whatever area you're traveling to with your specific Advantage plan. Medigap is a little bit more simple, as you can see any Medicare doctor throughout the country. And Medigap, many of the policies also are going to cover, about 80% of medical needs in foreign countries as well. Now, there are some specific nuances to that that we won't get into today based on the Medigap policy you have. So if you did have any specific questions, that's one where you might want to do a bit of research, talk with our team here, or perhaps talk with a Medicare specialist. Okay, yeah, so we've got another question here about signing up prior to your 65th birthday, and when does coverage become effective on your birthday? And so, yes, the answer to that is once you're 65, if you signed up prior to turning 65, then you will have coverage once you are 65. So the answer to that is yes. Oh, yeah, you got that, Olivia?
Another question that came in is related to special enrollment. So I mentioned earlier, if you're in a situation where you're retiring after age 65 and still working. So the key thing you need to understand is there is an 8-month special enrollment that starts when you stop working. So this is in place even if you have COBRA or other non-Medicare coverage. So you want to make sure when any of your current coverage ends and that you make sure you sign up for Medicare. The other thing that you should be aware of is, in order to avoid a tax penalty, if you and your employer are contributing to a health savings account or HSA, you want to make sure you stop doing that about 6 months prior to retiring so that you don't get a penalty on that. You actually can't contribute to an HSA while on Medicare. So Medicare A actually could overlap when the contributions are made, creating that tax penalty. So just be aware of that factor as well when it comes to that special enrollment period.
All right, we've got another question here. How much do premiums increase as income rises? This is a really great question, as premium increases do start to tick up rather quickly as you eclipse some certain income brackets. So what Medicare does is they look back at your prior 2 years of modified adjusted gross income. So that's a number that you're going to want to either talk with your accountant about or look at your previous tax returns for. And what they're looking at is if you are a single filer and you make over $91,000 a year, your premiums will move from $170 a month to $238. And this is just the first bracket. And if you are married and your income, your modified adjusted gross income in prior years was above $182,000, then your premiums are going to see that same increase from 170 to 238 per person per month. So you'll notice there that that is about a $70 per month per person premium increase. And they also tack on a bit of a Part D premium increase. And that continues to escalate as you work up into higher income brackets, but we won't cover all that right now.
We've got lots of good questions. Another question that came in related to the income limits that Jake was just talking about is how is it impacted if one spouse is on Medicare and one is not? It really looks like Jake was going through those income figures. It looks at your taxable, your joint income. So one spouse working is going to affect the other's Medicare premium. So good question. And then we'll just quickly answer two related questions that are about working in Medicare. If you're still working, can you choose not to do Medicare? The answer is that yes, you can choose to not go on Medicare if you want to stay on your employer's plan while you're working.
James, I want to come back and add a comment to a question that I think it was the first question we asked about if you sign up for Medicare before your 65th birthday. And we gave you the basic answer of yes, you'll be eligible when you do turn 65. The more specific answer to that is you will be eligible for Medicare coverage in the month you turn 65 if you signed up in advance. If you sign up in the month that you turn 65, so if you turned 65 today and you signed up 5 days ago, then your coverage would begin on December 1st of this year.
Okay, great. Thanks for all the great questions. I am James Smith. I know you can't see the video, so I'll introduce myself. And as Livia had mentioned earlier, I'm going to talk a little bit about getting expert advice on Medicare. Because I think as we go through this, it's pretty apparent that the process of getting Medicare and choosing your own policy can be pretty overwhelming and just confusing. In fact, after this webinar, I think that you all now fit into an elite group of Americans because there's some pretty interesting statistics on what the average Medicare eligible American understands about Medicare. So 80% of Medicare eligible Americans do not understand what makes up original Medicare. 69% don't understand what makes up Medicare Advantage. And even though most people don't know what those policies are and what the differences are, 58% end up staying in their current Medicare plan year after year without really knowing what it is that they own. So this is really a decision worth getting right. And so what we would say is make sure you get the necessary help. And so I can't emphasize that enough. We strongly recommend that you work with an expert in finding the right plan for you. At Aspen Capital Management, we are many things, but really we're not Medicare specialists. A specialist will be able to make sure that you select a policy that really fits your needs, covers all the prescriptions that you need, and make sure that you can work with the physicians that you would like to work with. Also, this process of choosing a policy doesn't just apply to people who are now turning 65. This is also really true for anybody who is over age 65, because selecting a Medicare policy isn't a one and done thing. Coverages and costs are constantly changing for each plan. So year to year, you should really be assessing your options, or at least every few years, because odds are that today a different policy will either be cheaper than the one you have now, or it will have better coverage than the policy that you selected like 5 years ago. So the general advice is that you should kind of reprice out your policy and see what's in the marketplace. Now, sometimes, just as a kind of a disclaimer, sometimes that isn't possible to make a change because sometimes, depending on what policy you have and what you want to switch to, you might get stuck in that policy that you already have, just because not all, like for example, Medicare Advantage policies aren't standardized. And so it really depends on the state that you're in and whether or not they limit pre-existing conditions. So the general advice is make sure you look at repricing your policy and seeing if it still fits you. Sometimes though, you might not be able to. So when it comes to selecting expert advice, there's really two general paths that you can follow in finding the right specialist. So one great option that many of our clients use is finding a Medicare specialist near where you live in your area. If you don't know of any, start talking to your friends in the 65 and over club and see how they got their policies. and if they know of a local specialist, because they had to go through this at some point, and so odds are they can give you some good advice. The other option is a company called Health Pilot, which you can use regardless of where you live. So Health Pilot is an online option that helps you quickly compare and contrast Medicare plans for specific coverages and for costs. And really, like, their big selling point is that they make the process very transparent. When you use Health Pilot, you can do everything self-guided online, or you can call in with any questions to speak with an expert. Health Pilot, like all Medicare specialists, they make their money by being the agent on your policy. This cost that they make in their revenue is baked into all Medicare policies and is at no additional cost for you using their services. So that's already in the policy cost. You using Health Pilot is not going to cost you anything additional. The one thing that is very unique, in our opinion, about Health Pilot is that their employees do not get a commission, and they're not financially incentivized to push certain policies on you. So Health Pilot as a company gets money from they get their revenue from being that agent on the policy, but the individual people that you'll talk with, they're salary based, right? And so they're not incentivized in any way to try and upsell you, which is important. And again, these agents are all licensed in all 50 states for Medicare policies. So now, to get a little bit into how this works, you can do much of the process, again, self-guided, as much as you would like, and you can really learn as much or as little as you like, because their website has tons of educational resources on all things Medicare. So you get started by answering a number of questions about you and your medical situation and history. A really cool feature that they have is that you can elect and you can choose to use their medical import function. Their medical import function will pull in 2 years of all your prescriptions and preferred doctors, and that way they can evaluate those specific details to which policies you're looking at. So it will use all of this information to rank all of the policies and rank the top policies for you based off of your cost and covering your specific needs. And then each year you can go back and easily compare your existing policy to the ones that are out in the marketplace. So Health Pilot, if you're interested in using it, you can just go to their website, healthpilot.com. They also have a mobile app. We haven't really seen the mobile app and exactly what it's like, but that is an option. So if you're comfortable with technology, I would just say this is worth checking out, and it can be a good option. So now we'll transition back to looking at any questions that you send in. So if you have some questions and haven't submitted them, we would encourage you to do so now, and we'll see what you've submitted.
Hey, James, one of the questions that came in was inquiring about how Medicare coverage works with Social Security benefits. Can you speak to that?
Yeah, good question. And I'm wondering if whoever asked this might have been on our last webinar, which was all about Social Security. But there's not a huge tie between Medicare and Social Security. Really, the only thing is that Medicare Part B premiums are automatically withheld from your Social Security benefits. And so it's kind of like a tax withholding, but it's a Medicare Part B withholding. And you can actually go in and you can go in and elect to also withhold your Part C and Part D coverages. So that's really the only relation, I would say.
James, one more question we have here is do Medicare supplemental insurance plans cover long-term care needs? That's a really good question. And the answer to that is no. Medicare nor the basic plans or the supplemental plans are not designed to cover your long-term care needs. So that's like adult assisted living care, Alzheimer's care, nursing care. The Medicare is not designed for that over extended periods of time. Okay, we got a question here where it says, sounds like cost is based on household income, like buying health insurance in the marketplace. Yes, that is a very apt analogy there. I would agree. So your Medicare premiums are going to be based again on your level of income. Most people do fall under that married level of $182,000 of income into that baseline monthly Medicare premium of $170 a month. But if your taxable income does continue to go into higher brackets, you will pay a higher Medicare premium.
All right. We appreciate how generous all of you have been with your time. I know that we've gone a little over the time that we told you to expect. So if we didn't address your questions, we promise to get those back to you with the response. We've archived the chat there, and we'll make sure to get those to you. I just wanted to make sure that we gave you a recap of the purpose of today's call, and hopefully we met your expectations in terms of giving you some guidance on the key dates and trigger events related to Medicare. Also, hopefully we gave you some thoughtful considerations to think about as you decide what level of supplemental coverage would be beneficial to you, as well as guiding you towards resources for help working with an expert near you and being able to leverage that in more detail. So we greatly appreciate your time today.
And so the last thing that we wanted to remind everyone of is that we post all of our webinars as YouTube videos. You can access them through the Aspen Capital Management website through our resources tab. The second point here is that if you do have any questions or you'd like to review the information we went over today, just request that one of us send you the notes, and we'd be happy to send it along. And lastly, connect with your advisor if you do have some specific questions related to your personal situation or your family situation, and we'd be happy to discuss with you. Thank you all for joining us today, and have a great rest of your afternoon and a happy Thanksgiving next week. Thanks again. Bye, everyone.